Nationally, there are, just looking at housing alone, there are 5 million vacant houses, and that's probably an underestimate. On top of that, there's more than 6 million occupied houses that are substandard, that are deteriorating. When you add on to that commercial vacant properties, industrial vacant properties, vacant lots, there is a profound amount of vacant and deteriorated properties that are actively harming people's health, people's wealth, and their overall quality of life. So it is those properties, it is that issue that my organization was set up to try and change. So we're a national nonprofit. All we do is focus on vacant, deteriorated properties. And our point of intervention really is public policy. Public policy led to many of the conditions we're experiencing right now, and public policy is absolutely imperative to help get us out of it. It's because I'm not talking about 1 or 2 vacant properties. I am talking about entrenched vacancy, and we need, for that reason, a systems level approach to try and address it, and that's exactly where public policy comes in.
Welcome to the podcast. You are listening to the Health Disparities Podcast from Movement is Life. I am your host, Michael Randall, coming live from Detroit, Michigan. Today's conversation explores a part of health equity that often goes unnamed, but shapes everything about how we live: vacant properties, neighborhood conditions, and the systems that determine whether communities thrive or decline. Our guest is Danielle Lewinski, Chief Program Officer at the Center for Community Progress. She is a national expert in urban revitalization, land banks, property tax system, code enforcement, and equitable reuse strategies. Her work helps local governments across the country transform vacant and deteriorated properties into assets that support safety, mobility, and long-term well-being. Danielle, welcome to the Health Disparities Podcast. How are you today?
I'm doing great. Excited to be here.
Awesome. So you said you grew up seeing that some communities were set up to thrive while others were expected to tolerate disinvestment. When did you first begin to understand that neighborhood conditions weren't accidental?
Yeah. From a young age, honestly. So, by the time I was probably around 6 or so, Detroit at that time had lost nearly 1 million people. And the impact of that on neighborhoods in Detroit was so profound. I mean, you could not come to the city and see neighborhoods that were thriving all over the city. There were pockets that were really vacant. There were pockets that were still thriving. But seeing that contrast, myself, I lived about 15 minutes from the border. And where I grew up, if there was a vacant lot, you got a new house. And there was not long-term vacancy. There was not long-term deterioration. And just from a really young age, being able to see such stark differences so close together really stayed with me. And that trying to understand that inequity, that injustice, why the built environment sort of became that way, that's been a really driving force for me. So, I just don't have a point in my life when I remember not caring about vacant properties, wanting to know more about vacant properties. And that's really because of, where I grew up, how I grew up. And I think the link to health, well, it might be immediate for some people, not for everyone. It might just seem to be an aesthetic issue. But there have been so many studies that have shown vacant properties, deteriorated properties, those lead to chronic health conditions. There will be worse mental health, worse overall physical health and well-being. And so they are so interwoven together. And unfortunately, because a lot of the past policy decisions, the racialized policy decisions, that sort of impact, that health impact of vacant and deteriorated properties not felt evenly. It's felt more profoundly in low-income and Black and brown neighborhoods. So that really has been the crux of where I've tried to focus my career is solving that and improving the policies that have created those conditions and that can get us out of those conditions.
Fantastic. And so, based on your profile and your background, obviously your work has focused on land use, vacancy, land banks, things of that nature, right? Things that are in the built environment. At what point in your career or in your life in general did you start seeing the health implications of, let's say, land use development, land banks? You mentioned Black and brown communities and whatnot, the disproportionate impact. What was that moment that really started to become more salient to you, and you decided to really look into this work from a different angle?
So I was in grad school, and a part of a work study that I had was volunteering with a local community development corporation. And I helped to lead a cleanup of a vacant property. So there was a team of volunteers that came. We cleaned up the brush. We boarded up the property. But in doing that, I was inside the property, and I was looking at all of the elements of lives and love that had been in that property before that point. So old family photos, all of that. And having such a visceral reaction to how clear it was that people and property, they are not separate, even though our sectors sort of deal with them separately. They are one and the same. What happens with a property impacts that person. That just really, that sat with me. From that point forward, there was never any separation between vacant and deteriorated properties and the person. Those are together, either the legacy of what was there or how that is still continuing to harm or impact the surrounding residents. So I would say that was certainly a very pivotal moment. And then also in the communities my organization, Community Progress, serves, it's primarily disinvested areas. And in those communities, because resources are strapped, you got to get creative about where you're looking for partnerships, where you're looking for resources. And because of that reason, it also, I think, has led to more interesting partnerships because you have to look outside of what might be a traditional sector. And so healthcare industries, hospitals, those have been good partners, need to leverage them more, but have been good partners in trying to solve these issues.
Absolutely. And so you touched on Community Progress. For listeners that aren't aware or may not be engaged with your organization, what would you say the mission of Community Progress is as you take a national approach to solving these issues? So
nationally, there are, just looking at housing alone, there are 5 million vacant houses, and that's probably an underestimate. On top of that, there's more than 6 million occupied houses that are substandard, that are deteriorating. When you add on to that commercial vacant properties, industrial vacant properties, vacant lots, there is a profound amount of vacant and deteriorated properties that are actively harming people's health, people's wealth, and their overall quality of life. So it is those properties, is that issue that my organization was set up to try and change. So we're a national nonprofit. All we do is focus on vacant, deteriorated properties. And our point of intervention really is public policy. Public policy led to many of the conditions we're experiencing right now, and public policy is absolutely imperative to help get us out of it. And it's because I'm not talking about 1 or 2 vacant properties. I'm talking about entrenched vacancy. And we need, for that reason, a systems level approach to try and address it. And that's exactly where public policy comes in. So my organization will help local governments, county, state governments, federal, change the policies so that they can more effectively, efficiently, and equitably address these problems. So
I'm talking about small P and big P.
You got it.
Is that still a thing now?
Yes, sir. Yeah, that's exactly right.
Wonderful. So amazing work. So Community Progress last year has worked in over 125 communities nationally. We had a really great conversation in the unofficial green room out there. And we were talking about the role that policy plays, and you touched on it a little bit. But what are the main issues that local governments are bringing to you, and how are you approaching solutions in those areas?
Absolutely. So starting first with deteriorated properties. So we want to try and make sure they don't become vacant. What we look for with communities at that point is whether or not the code enforcement systems they have are able to hold owners accountable. And this is what's super important that most people don't look at. You both need the ability to hold an owner accountable, but you need equitable off-ramps because many owners want to fix up their property. They either physically don't have the ability to or financially don't have the ability to. So what you don't want is a public policy that will effectively strip them of their title, of their wealth, simply because they don't have the financial resources or the market strength in their neighborhood to support lending to fix up the property. So code enforcement, that's a huge area. Then once a property is abandoned, we don't want it to sit that way for years and years and years. We want to try and transition that to a new owner. And the tool we usually look for there is property tax foreclosure. Unfortunately, in a lot of states, this can be a 6, 7, 8, 9, 10-year long process. That is too long when a property is vacant and abandoned and hurting the community. So we're usually looking for ways to try and make sure that that can be a swift process. Again, that there are equitable off-ramps that you might need to put in place to support property owners going through hardship. Then once a property is with a public entity, it could be through a land bank authority, which is a public entity designed to help deal with vacant properties, that it can be moved to a community either purpose or to solve a community challenge. And then the final thing I'll mention, because it is often overlooked but underpins all of this, is making sure communities have a vision for what they want to use those properties for, what they want their community to be, where their assets are, how they want to leverage those. Because absent that, what we see is a bunch of haphazard strategies that just aren't really making an impact. So those are really the ones we're looking at. A lot of those are deployed by local governments. A lot of them are impacted by state law. And then federal resources typically help from a funding standpoint.
Fantastic. Absolutely. You know, I actually live in a community that has been impacted by your work. Personally, Grand Mount Rosedale here in Northwest Detroit. Funny story, this morning, I came outside, I had a flat tire and I wasn't able to use my wife's car because my 6-month-old had her 6-month checkup. So I wasn't able to use her car, but I live 3 minutes away. So I just walked to work, right? And that is because I'm able to move about my community and we're not dealing with those large levels of vacancy that impacts one's ability to move. This is the Movement is Life podcast, Health Disparities Podcast. What would you say, Danielle, is the impediment that vacant, underutilized, disinvested properties has on an individual's ability to move about their community?
So one of the primary challenges with vacant properties and mobility is that because of the state of vacant properties, it can elicit feelings of fear and avoidance. So if you have vacant properties around you, even if you just have one on your block and there's illegal dumping, so a bunch of trash, maybe construction debris that was dumped there illegally, that can harbor, rodents. It can harbor a whole bunch of bad things that can impact your health. In addition, because if you have vacant properties, the lighting on your street might not be all that good.
Absolutely.
So I think the primary issue is people genuinely not feeling safe, not feeling comfortable, or feeling like there might be a real threat by walking along their streets, by walking to their, to their church, to their school, et cetera. And for that reason, the presence of vacant properties really does impact and harm mobility. And it primarily is driven from legitimate fears with respect to safety, but also just perceptions that can impact that as well. So that's one of the reasons why we see higher elevations with respect to chronic disease, et cetera. It's because these properties create conditions where a person might not want to be more mobile. Aside from sort of external mobility, also just moving around the house, your home safely. If you have a lot of property deterioration challenges, that's a problem. Also just trying to get up, get about, and get through your property, not just walking past others.
Absolutely. You touched on this earlier, and I definitely want to drill down on the impact of good policy, right? I work in an organization where we develop, right? We build things, right? We do critical home repair. We do housing, multifamily, commercial properties and whatnot. And sometimes the unseen impact of policy for individuals that may not be aware, they just don't know, right? And so when we're talking about making communities more safe to move about for elderly individuals, for disabled individuals, children, right? What are some direct policies, either, big P or small P policies that can directly impact those individuals' ability to move about their community safely?
There's a whole range. I mean, the The quickest, lightest touch way is minimally talking with your city government to see if they can do strategic and targeted cleanups of the vacant properties, the dumping, and also boarding up properties so they're safe. What we have seen is communities trying to focus those where you might have a density of children, where you might have a lot of elderly individuals, or around key assets like places of worship, like schools, so that you have these safe routes where people can move about. And a lot of times communities will have limited resources. So the idea here is to make sure you're using them in a way that can benefit the most people and recognize it's just how people need to move and get to resources throughout their neighborhood. So that's absolutely a huge one. Governments often need support, though, especially if there's not enough funding. So that's where we see community engagement being huge, trying to make sure that these properties can be maintained. There was a study that showed lower firearm violence, for example, when communities themselves got engaged in the stewardship of the vacant land around them. So it has real benefits extending, past an individual. It goes throughout the entire community. So those are sort of shorter term, more immediate things then that can be contemplated. Longer term investments that we've seen is looking at where there are vacant properties and how to weave those into mechanisms that provide safer mobility. So greenways, for example. Just here in Detroit, there's the Joe Louis Greenway that's being constructed out of an abandoned rail corridor. So that's a creative use of vacant properties. And that is a greenway that will be able to connect multiple neighborhoods and create safe mobility areas. But it doesn't need to be as large scale as that. So in Erie, for example, their land bank had a neighborhood with some interspersed vacant lots. What they've done is they are creating pocket parks and basically routes through the neighborhood. So you can traverse the neighborhood safely in a green area. You can walk to a park with your child or your grandchild and be able to get through the neighborhood. So these are such a tremendous asset that is underutilized, vacant and abandoned properties and deteriorated properties to try and add assets for mobility.
You touched on, green reuse, and the Joe Louis Greenway is a great example of that. For communities like Flint and whatnot, or even a lot of communities here in Detroit that have large swaths of vacancy, right? There could be a desire for housing to return and whatnot. What would you say to the concept around zoning that could potentially usher in green reuse, but if the demand goes up for housing, maybe it goes back to single family or multifamily zoning and whatnot. That's something that we hear a lot in the community development space is we support green use. We understand the mobility and whatnot. But if there is an opportunity to do more housing and create more composition with green use and housing, so kind of what would you say to communities that are thinking about that when they look at large swaths of vacancy?
That is a common question that we get. And a lot of times what we'll hear from communities is, yeah, I'm okay with green reuse as just a temporary strategy. So maybe we do this for 5 years or maybe a couple of years, but then of course it's going to be a house again in the future. And I think in many respects, that approach is short-sighted. So it depends on the community, but a lot of communities were designed originally with not enough green resources for the health and sustainability of the community. And the patchwork or the infrastructure of vacant lots is a great opportunity to try and solve for that in the future. So the notion that, success for a vacant lot is if there was a house there, there should be a house there in the future. If there was a factory. That I think that is not necessarily taking into account all of the added benefits from alternative land use strategies. So there's definitely a time and a place to have a transitional use, but what I would challenge a community is to look at where you can create permanent green spaces, not just in one area, throughout the entire community, and then try and create denser housing opportunities. So you still are able to add in critical affordable housing, but you're doing so in a way that provides those residents with more readily accessible, childcare, healthcare, food, because they can walk to what the resources that they do need. So yes, absolutely, housing development is needed in many areas, but so too is green infrastructure, and that shouldn't be viewed as a temporary or an optional asset for a city.
Absolutely. Definitely. So let's get into some misunderstandings about vacancy, right? In the community development space, residents could come to me and say, hey, Mike, this property is blighted because this owner had it, or this commercial parcel will never come back or never reemerge as anything viable for the community and whatnot. So what would you say to the notion or the myth that vacancy is just an aesthetic issue or some type of, personal failure upon maybe the municipality or the city or even a property owner? And which of these misconceptions is most harmful when it comes to creating solutions in the vacancy space?
I would say the notion that vacancy deterioration is that individual's fault or that city's fault. And that is said to me, and I've been doing this for, working on vacancy specifically for 20 years. I've done it nationally. That is a mantra, a notion that I've heard repeatedly, either explicitly or implicitly. And the harm in that is at the end of the day, yes, there are absolutely bad actors. There are individuals that are having a predatory approach with how they're using properties, how they're using land. But there are a lot of individuals that aren't able to fix up their property, aren't able to reoccupy their property because of larger scale macroeconomic issues. So in a community, and I mentioned this earlier, you might have such a depressed market value that even though, I might have good credit, I might have all these other things, I don't have the ability to get a loan. No bank is going to finance because I live in an area with really depressed housing values. That is not my fault. That has to do with much larger forces at play. So sometimes what we'll hear when we talk about the need for government support or philanthropic support for home repair is sort of the moral hazard. Why are we rewarding someone who hasn't maintained their property? The answer is because they might have physical limitations, because they have financial limitations, because the entire area has financial limitations. So I think that is the most harmful sort of misconception that I either hear or you can tell is implicit in the responses and the policy approaches. And so I think it's apropos we're talking about it. This month is National Healthy Housing Month. So, hopefully that's something we can start to change and illuminate, that there are much bigger issues. And, I'm not sure if you've seen this in your work in Grandmont Rosedale, but it's not up to the individual all the time.
Absolutely not. We actually dealt with that directly, because we were talking about this earlier as well. It's like there are individuals that may have purchased home during the bankruptcy, right? I like living in a house. I'm pretty sure you like living in a house. And so these individuals bought a home to live in, right? However, they bought a house that was several decades old, right? And so there may have been deferred home repair. That is just a reality of living in a home that is older, right? I, purchased my home 2017. My house is over 100 years old. It is going to have that need for critical home repair at some point. Your ability to pay for that is not moral hazard or whatnot if somebody comes and helps you or provides some level of assistance for critical home repair. And also, what are the reverberating impacts of, assisting that individual, making sure that house stays viable in the community. So I could not agree more. So we talked about policy and, unfortunately, in the community development space, sometimes even in the advocacy space, policy spaces, we become reactive, right? And so what is the benefit of thinking more about working upstream, thinking about working more about being proactive as opposed to being reactive? What would you say to that?
So there are many answers to that. One that matters a lot to people, it's cheaper.
Yeah.
Because at the end of the day, if we don't do anything to help, it could be a house, it could be a commercial property, it could be industrial. Once we're starting to see that there might be some systems failing, once we're starting to see, the property's deteriorating a little bit, maybe we need to put in for a house $50,000 to make that house livable again. The other option is let that house deteriorate to the point where it can no longer be saved. Demolition is going to cost you $15,000, $20,000, some $1,000s, depending on your community. And then after that, you're going to need to invest $300,000 to put another house there. So what we could have done is upfront tried to invest to prevent additional harm from happening. And there are city systems that can try and identify where there might be some of these early warning signs that a property is having some issues. So that is one of the most basic things that usually resonates with people, regardless of what side of the aisle you're on, north, south, east, west. It is more efficient, it's faster, and it's cheaper to do preventative work as opposed to trying to deal with the issue after the fact. True in health, also true in housing.
Absolutely. So we look at this current landscape in the city of Detroit, but in other urban areas or even rural areas and whatnot, dealing with this issue of vacancy and whatnot. And I always say that it's very important to define or even redefine success. So Danielle, what would you say success looks like in your work? And this could be short-term or even medium and long-term.
Sure. So I think for some, they might expect my answer to be, well, if it's vacant, occupy it. If there was a house there, put a house there. That's not my definition of success. My question is whether or not that property is solving a community challenge. If the answer is no, then it's not as big of a success as it could have been if it's occupied. And that's where we need to think about what the community needs beyond just that physical structure. Again, what are the community health challenges? For example, a lot of the vacant property that's out there is controlled by public entities. So if I have a property, it's gone through tax foreclosure, it might be controlled by a tax commissioner. Their job is to get that back on the tax rolls. It is not, it's not necessarily within their framework to think about, well, what are the health challenges in that area? Oh, this is an area that has really poor health quality. So we should be using that property instead for tree canopy to try and reduce dust particulate. So I think what's important is that success is not viewed so myopically, that we're looking at all of the needs of the community and importantly, connecting the health sector to the property sector, to the built environment sector, because, you can't assume necessarily that tax commissioner knows all of those health things. Conversely, I can't assume that the health sector knows why the taxable value is so important to that tax commissioner. So there needs to be more dialogue. Once I start seeing this cross-sector support, that's usually where success comes into play for me.
Absolutely. Wonderful. So let's leave the people with some hope, right? Let's do an example, a real life community example of what these solutions look like when there is meaningful system changes. We talked about working upstream. We talked about big P policy, small p policy. We talked about a more informed understanding around, misconceptions of what vacancy means and who's the culprit of that, right? So give me an example of kind of what it looks like when when all cylinders are firing. Like, what does that look like?
Yeah. So what it looks like, it's multifaceted programs that are moving at the same time towards the same outcome and an outcome that's community informed. So like high level, that's what it looks like. I will say, certainly what is giving me hope right now is that, as I mentioned, regardless of your political lean, regardless of where you're living, and there have been surveys that have shown this, people care about health. People care about wellness, and overwhelmingly, people want the government doing more to try and improve those things. So actually, I would throw it back to you as you're doing this work on the ground in Grandmont Rosedale. Like, what is the thing that is giving you the most hope? What is that success that you're pointing to right now?
I would say, looking at the fact that our previous vacant property task force is looking for new work to do, right? The vacant property task force that was developed in Grandmont Rosedale was tasked with looking at how to solve for vacant single family homes and not spiking the football. Obviously, we have a lot more challenges in that regard, but now that task force is looking at commercial properties and how to tackle that, right? And so I think that is a result of good policy, of residents coming together and solving an issue and whatnot, but then also being solution oriented, right? So again, we know that the challenge is still there, it still persists, but I'm hopeful now with all this new education I have from you that I can, from where I sit at Grandmont Rosedale, I can play a more critical role in now, shifting the narrative to commercial properties and creating more solutions.
I'm so thrilled to hear that. I'm thrilled to hear the diverse approach you all are taking with respect to looking at community revitalization, vacant properties. I would certainly say both for you, for anyone listening, we have an opportunity and space to really hash these out, to look at examples at our national conference, which is coming up in September. It's in Pittsburgh, and we're opening up registration in later this month in April. The reason why I mention it is because that, trying to look at where there are new opportunities, trying to look at where there are successes, how to model success, how to scale, that is exactly the conversation I love having, and getting practitioners together in a room to talk about that is so invigorating. So definitely encourage you to come, Grandma Rosedale to come, but anyone that's interested in that topic.
Definitely. And definitely, commercial properties as well along our major corridors in the city. It is a different beast and it involves a different strategy. Obviously, we're still talking about vacant properties, but perhaps we can have that conversation during that summit. So in closing, for local leaders, residents, organizations, individuals that are looking at this issue, what would you say is some parting words that you would like to leave with them to begin addressing this issue in their community?
The first, look at the issue. Unfortunately, a lot of people have become accustomed to it. They just do not pay attention to it. They accept it as just the way things are. Don't. If you do one thing today, look at a vacant, look at a deteriorated property, bring it to your awareness. And then 2, start asking who owns that property, what's going on with that property, and then having conversations with local government. So it really starts from very small activities, small movements to get us to there. And I'd say, you are not alone. It is not just your neighborhood. It is not just your city. It's not just your state. This is an issue across the United States in rural areas, in urban and suburban. And so just know that there are people out there who have found creative solutions, who have figured out how to improve mobility, improve health through the reuse of vacant properties, through the repair of deteriorated properties. So, learn from them, try and have dialogue and conversation with them. And at the end of the day, if we can be helpful to anyone at any point, certainly let us know. You can email at us at info@communityprogress.org. I mentioned our conference that is happening. Yeah, you are not alone. And there are a lot of strategies out there.
Absolutely. Well, Danielle, we appreciate your time today. We appreciate your work. I, for one, haven't been in this space of placemaking and community development with a health focus for the lion's share of my career. I am really happy to have met you and had that conversation. So I know there's another warrior out there that understands the linkage between the built environment and health outcomes. It is very, very important. So Danielle, thank you for all your work. For listeners who want to learn more, visit communityprogress.org. Follow the Center for Community Progress on LinkedIn, Facebook, or Instagram, and check out the Reclaiming Vacant Properties Conference happening September 22nd to 25th in Pittsburgh. This has been the Health Disparities Podcast, where movement is life. I'm Michael Randall. Until next time, be safe and be well. Thank you, Danielle.
Thank you.